to determine which knowledge should be pushed out to him, so it will be in complete context. This knowledge is well known in medicine, this knowledge model. Down here we have the patient-specific knowledge, the acts, the treatment, the observations, the signs, the symptoms. Up here we have the diagnosis, the syndromes, the methods, and up here we have the pathoanatomical disease model, gene theory, and things like that. And as a healthcare person, you must be able to use the whole field of knowledge, but the patient will probably only use the heuristic layer and the phenomenological layer. But they need knowledge in context in different situations. Again, just to illustrate it by art, here we have Pasteur in his laboratory looking at a bacteria. Here in the heuristic layer we have an X-ray of a patient with tuberculosis, and down here we have the patient in bed. It's actually a picture of the young Picasso, and you can see it in the Picasso Museum of Barcelona, just north of here. Another art I would like to use is to demonstrate or to envision what is in a healthcare provision. I use this painting here, and what is in a healthcare provision is technology. In this example here, it was sulfur ether on glass flask. Here we have also in this healthcare provision the manual work, and here we have the knowledge that is activated in the healthcare provision, and we have the teamwork around the healthcare provision. And these four components you must be able to distribute by information technology if you will provide healthcare provisions. And this is also a reference what we are talking to the users. Now onto the experimental thing. We use diabetes, as I said, as the archetype of the chronic disease. We use real families, and what we are aiming at is actually to support the patient's part of the teamwork in diabetes, which is round-the-clock balance of food, exercise, and treatment to keep blood glucose within tight limits. Long-term complications, which is the healthcare system's responsibility in diabetes, could be, as an example, kidney function, which will deteriorate over time at diabetes. We will not take this into consideration. In this project, we are taking into consideration the balance between food, physical activity, and insulin, the everyday balance that the patient has to be doing 6 or 8 times a day, depending on when they do physical exercises or food intake. So just to envision that, I'll give you a small scenario. This is a small fishing town in Denmark called Skagen, and we are now in the year 2015, and they are not doing any fishing anymore. The museum trawler is lying here, and it's a very nice museum depicting how to fish, complete with a seagull on top of the roof there. It's actually an antenna in disguise. Here we have Karen. Karen has had diabetes for 3 months. She is carrying a bear, and in this bear there's a hardware-software complex that communicates. It's her digital avatar in the diabetes services world. And when she approaches this sign, it goes down to her height and displays the menu items that she can eat. And when she comes inside, it will calculate her insulin dose, it will calculate her exercise, and it will calculate whether this exercise will be in wet or dry sand, which gives different results. We are trying to make this, from this scenario, a similar setup of an experiment. We started with the user needs. They are conceptualized, and we are about to do that now. And we'll do the living lab testing in the first cycle in September in Skagen in Denmark, and then we'll do a new cycle here. In the first cycle, we'll use commercially available software and hardware, and in the second cycle, we'll make our soft and hardware complexes ourselves. That will mean the teddy bear of Karen. For this conceptualization, we'll use sensor technologies and all kinds of other hard and software technologies. So what we have done so far is taken the interviews by users, we're taking the user requirements and what we have of specific technological possibilities and put it into our knowledge model, and we have generalized this to user concepts and general technical solutions that I'll talk a little bit about just very fast. And we are, of course, using our knowledge from the medical and human sciences to create these user concepts. As I said, the starting point of this is the calculation, the diabetic triangle between food, insulin, and exercise, but this cannot be calculated